Hi, I'm Sherona, nurse practitioner from UCLA. So I actually manage a lot of MASLD and MASH patients. A few questions that I always hear from the patient is when they find out that they have fatty liver, they do not know how severe it is. They will always ask, I want to know my life expectancy. I want to know if there's any chance that I develop liver failure or if there's any chance that I develop liver cancer, or they will always want to find out if there any risk for my son or any family member, if there's anything can impact them. I think it's very important that we address that question because patient came in, they do not know anything about fatty liver. And as a provider, we need to give them the answer. First of all, we need to do risk stratification because patients come in with abnormal ultrasound show hepatic steatosis, basically cannot tell you what kind of fibrosis or what level of fibrosis the patient has unless the patient has cirrhosis. Otherwise, it will just show hepatic steatosis. So very, very important is they need to know how much liver damage the patient has. And as a provider, we definitely will do a risk stratification and we use a lot of non-invasive testing. The first thing we will do is FibroScan to see how much fat the patient has and also how much liver damage the patient has. And according to the liver damage, we will actually guide them what kind of management and treatment the patient will have. Because now we have medication to actually treat patient that they have level 2 and 3 fibrosis. And if the patient that they have cirrhosis or maybe they have high level of liver damage, the medication might not be appropriate. But we do have medication to actually treat patient that they have stage 2 to 3 fibrosis. So it's very important that we give them those information so they know that is a treatment. So they have hope to actually help the MASLD and MASH. And also if they have any risk factor and if they have any type 2 diabetes or overweight, you need to actually connect them with endocrinologists and dietitians and cardiologists. That is very, very important because don't just look at the liver. There's a whole body liver diseases, not just the liver disease, it's a whole body disease. So you need to let them know that's important to follow up with their provider to take care of overweight and metabolic syndrome. And the other thing is because it's fatty liver, because it's hereditary, I think it's important that their family member, their kids also need to screen for fatty liver. So those are the information that I will tell my patient. And thank you for listening. I hope this podcast will help you. And if you have any question, reach out to our community network. Thank you so much.